just laying there at night, have these horrible stomach pains.
I was just helpless and didn't honestly know where to turn, and I didn't know if anyone actually understood where I was coming from.
The signals just get mixed up. It's a disconnect between the gut and the brain.
Dysregulation.
There's a direct interrelationship between your brain, your mind, your level of kind of anxiety, depression, and just general state of well-being and how your gut functions. And that interaction is extremely important and part of the behavioral medicine program in the Digestive Health Center.
For people with GI issues, we know that sometimes there's dysregulation along this communication pathway. The focus of many of our treatments are sort of repairing that communication pathway and kind of realigning the brain and the gut.
We have a very comprehensive center which involves collaboration with psychologists, dietitians and surgeons, and gastroenterologists and hepatologists together.
Gut-directed medical hypnotherapy is unlike stage hypnosis or perhaps hypnosis that people are considering when they first kind of hear that word hypnosis.
When the doctor told me about this mind-gut connection and that something was disrupting it, that was a whole new concept for me. And if you can just go under hypnosis, I thought, great, why don't I try it? You see it on movies and people getting hypnotized to do funny things.
You know what hypnosis is? When you're driving home and you're passing the poles and then all of a sudden you go, oh my God, here's my exit. And you don't even remember that last minute that you were driving, even though you know you were watching the road. That's hypnosis. That's the same thing.
Each session is 20 to 30 minutes, and it's really just very relaxing. It's almost like taking a nap.
Our body is really receptive to suggestions which can kind of benefit that realignment of that brain-gut miscommunication.
So cognitive behavioral therapy is an intervention that focuses on providing patients with education about their condition, about the impact of stress, and the role of their thoughts, feelings, and behaviors on their symptom experience.
So after being diagnosed with Crohn's disease and going through a resection surgery and then hearing that you should seek out therapy, you're taken back a little bit.
People think, oh, he thinks it's all in my head. And I always go back to the patient and I explain to them, all symptoms are in your head. If you didn't have a brain, you wouldn't feel pain.
It's really about identifying patterns in the way that we're thinking and responding to our GI symptoms and our condition. We're not treating the mental health symptoms, we're treating your GI symptoms.
So currently, most of the time, we use these behavioral interventions kind of after other things have failed. But in my opinion, I think this should be part of the entire treatment plan.
You can just see the relief coming over a patient, and that's nice.
I think the defining moment really was towards the end of the hypnosis. I don't feel the pain anymore.